this video, I will discuss the good, bad, and facts about bottle feeding babies. We will look at the advantages and disadvantages of bottle feeding, and some important points that parents should know before deciding how to feed their baby. 1. What are the benefits of bottle feeding babies? Bottle feeding can be a convenient and practical way to feed your baby. It allows you to control the amount of food your baby gets in each feed, and it also lets you know how much they have eaten. Bottle feeding can help establish good sleep patterns for babies by allowing them to get full faster, so they are not kept up at night due to hunger. For parents who work outside the home or have other parenting responsibilities, bottle feeding can give them peace of mind that their child is being fed on time and with nutritious food when they are away from home. 2. Are there any risks associated with bottle feeding? Yes, there are risks associated with bottle feeding. Firstly, improper usage of bottles can cause health issues such as dental cavities and ear infections. Secondly, when infants are fed with a bottle on demand, they may become overfed because it is difficult to recognize satiety cues in this case. Thirdly, more frequent feedings can also lead to obesity because an infant's caloric intake will be greater than what the body needs. 3. How can I know if my baby is getting enough nutrition from formula feeding? One way to tell if your baby is getting enough nutrition from formula feeding is to keep an eye out for signs of dehydration. Signs of dehydration include dry mouth, fewer wet diapers than normal, dark yellow urine, and no tears when crying. If you notice these symptoms in your baby, they may not be drinking enough formula and need extra hydration. 4. When should I start introducing bottle feeding to my baby? Introducing bottle feeding to your baby should be done gradually and with careful consideration. Generally speaking, the best time to begin introducing bottles to an infant is around 4 to 6 weeks. This gives your baby time to get used to the new sensation of sucking from a bottle nipple, as well as allowing their digestive system to adjust accordingly. You should always consult your pediatrician or lactation expert for personalized advice on when and how you should introduce bottles into your baby's feeding routine. 5. What type of bottles and nipples should I use when giving a baby a bottle of feed? When it comes to bottle feeding, there are many types of bottles and nipples available for parents to choose from. There is no one-size-fits-all solution, so consider what works best for you and your baby. Generally, a narrow-neck bottle with a slow-flow nipple is recommended for younger infants, while a wide-necked bottle with a faster flow nipple may be better suited for older babies who can drink larger amounts more quickly. It's also important to check the materials that make up the bottle or nipple. Look for BPA-free products made out of polypropylene or silicone. These materials are safer and less likely to leach chemicals into breast milk or formula. 6. Is it safe to give a newborn formula instead of breast milk? Yes, it is generally safe to give a newborn formula instead of breast milk. The AAP recommends that infants receive only iron-fortified infant formula for the first 12 months of life, and that solid foods not be introduced until about 6 months of age. However, due to the many benefits associated with breastfeeding, mothers should strongly consider breastfeeding their babies whenever possible. For babies who cannot or will not breastfeed, infant formula is an acceptable alternative. It's important to note that different formulas are designed for different stages in an infant's development. Talk to your pediatrician about which type of formula would best meet your baby's needs. 7. Are there any tips or tricks for making sure that my baby gets the most out of each bottle feed? Yes, here are some tips and tricks to make sure that your baby gets the most out of each bottle feed. Hold your baby in a semi-upright position while feeding. This helps to prevent air from getting into the stomach, which can cause discomfort. Make sure that you burp your baby frequently during and after each bottle feed. Burping will help expel the air bubbles that may be present in the milk, as well as reduce any chances of spit up or discomfort. Try not to overfeed your baby, as too much milk can lead to them feeling uncomfortable or full. If they seem to be turning their head away from the bottle, take this as a sign that they may be done. Monitor your baby's weight gain closely And make sure that you are following your healthcare provider's instructions for feeding schedules and amounts. If you notice any signs of fussiness or discomfort, talk to your pediatrician as soon as possible. This could be a sign of a larger issue or an intolerance to something in the formula or breast milk that is being fed. Finally, it is important to create a safe, comfortable environment during bottle feedings. Make sure that the area around the baby is free of distractions, noise, and disruptions so they can focus on their mealtime. A calm atmosphere will help make the experience more enjoyable for both you and your baby. It's important to consider the pros and cons of bottle feeding your baby. Ultimately, it comes down to what works best for you and your family. Bottle feeding is a great way to bond with your child while providing them with nutrition they need. However, there are certain risks associated with this method that should be kept in mind when making decisions about how to feed babies. We hope this video has provided you with helpful information on the facts related to bottle feeding so you can make an informed decision for yourself or someone else in your life who may have questions about it. If you found this content useful, please comment below and don't forget to subscribe.